tragic deaths in Colorado from COVID-19. They have all of our sincere condolences. My heart goes out to every family that experienced a loss in this crisis. As you can see, the daily growth rate is continuing to decline. As of yesterday, the growth rate is down to 2.8%. We're also seeing a similar trend in the hospitalization side. The growth rate yesterday was 0.4%. The virus is out there. It's contagious. We need to have social distancing, but we've avoided an immediate crisis in our hospitals by taking the bold steps that we've taken and thanking you for staying at home for 32 days. I know that wasn't easy, and I know that as we re-engage, we have to do it in a sustainable way with social distancing, a safe way. As small business owners open their doors, they're going to do it in a safe way with some of those same protections that you've probably seen at your local grocery store, carried across other kinds of businesses as they open their doors. And it's important for you as a customer to wear your mask, just as we're requiring the employees at those stores to do so as well. So during the safer at home phase, it's important to remind everybody it's not back to life as normal. We all wish it was, but that's not where we are today. Additional steps to protect those who are over 65 who really still need to stay at home as much as possible. And that means if you know somebody over 65, if you have a friend or neighbor in your neighborhood, if you can offer to pick up their groceries for them, to do whatever it is they need to do to reduce their risk. There's been a number of cases connected to Walmarts, to other stores. We're going to continue to see that. Let's try to do our best to help those who are in their 70s and 80s stay home, as well as the additional steps the state is taking around protecting our seniors in our nursing homes and senior care facilities. I know it's hard to avoid to not be able to see the grandkids or the nieces and nephews in a big family reunion for the month of May. I know that's a hard sacrifice to make if you're in your 70s and 80s, but know that your grandkids, know that your nieces and nephews, they want you to be with us a lot longer. They want you to be here in July and August and November and next year and the year after. And to make sure that you're going to be there to see those graduations and those marriages, it's really important that we avoid those visitations during the month of May when it continues to be very dangerous for those over age 65. Bars, restaurants, gyms continue to be closed. Schools have been closed for the rest of the year, but many school districts are really being innovative about using their buildings, their school buildings. They're having small groups in for vocational classes that they can't do through online. Could be a shop or welding class under 10 kids. Others are doing one-on-one and special ed services across our state in a safe way. As we work on what the path forward looks like for how school can resume in person in the fall, there's a number of examples across the world that we're learning from. Denmark, kids went back to school last week. Our school year is winding down, and so we're really focused on what they can do now to make sure that no kid misses out on learning. I talked to a superintendent earlier today. He said, you know what, Mr. Governor, I'm going to make sure that none of our kids are experiencing a learning gap because they're not in school the final 2 months. And I said, thank you. That's the expectation that we have of all of our educators, superintendents, and others who are tirelessly working to ensure that your kid gets a good education. I want to thank our educators, our principals, our superintendents for doing their best under very difficult circumstances. We also want to continue to have no groups of larger than 10. And of course, very soon, May 1st, the retailers across our state, stores that are now doing curbside delivery, as well as personal services. That means you'll finally be able to get a haircut or get your nails done. All that rolls out May 1st. And in parts of our state, that's May 8th. There's a week later that it rolls out in the Denver metro area, their choice based on the local situation there. But May 1st is a general date across the state, May 8th in other parts of our state. We've detailed very specific safe practices for all of those folks to do. And those are at coloradosaferathome.com. And if you run a nail salon or a barber or a store or a real estate company, any of those, you look on there, it has the exact things you need to do by what you do. And if you're a customer and you're interested in what steps they're taking, you should go there too, coloradosaferathome.com. It's really important that all of our businesses comply. And it's not terribly onerous from a cost perspective. We wanted to make sure of that. I know that our small businesses, no one's saying, oh, you got to buy some $10,000 machine with UV light. That's not what they're about. We know that they're really suffering, having a tough time. It's really about These practices they need to implement that have next to no cost or no cost. I mean, meaning decals on the floor so people can wait in line safely. How do you configure the traffic flow in your store so it's one way through the aisles? How do you make sure there's not too many people in at the same time? How do you do social distancing around checkout and avoid having items being passed back and forth? How do you deal with returns safely? So all of those items, very reasonable, very doable, incredibly important from a public health perspective. And I know that our small businesses want to keep their workers safe and, of course, want to keep their customers safe as well. And then Monday, May 4th, that's when in-office work can resume, when people can return to the office, but not at full capacity. Those offices need to have 50% less people in them than when this crisis first started. Telecommuting should continue. 50% is really the most that can go in, not the least. We encourage every business that can have 60, 70, 80% telecommute to continue to do that. If you can be productive and achieve that, have the minimal amount go in. But for other businesses that do need to have people go in, up to 50% will be able to go in on Monday, May 4th. Again, that date will be about 4 or 5 days later in certain parts of the state, and that's important that everybody follow their local rules in addition to these statewide guidelines that we're putting down. There's really 4 parts to the Safer at Home challenge. That is our challenge as Coloradans and how we're going to get through this period. The first is wearing facial coverings. We need to do a better job doing that. It's more important now than it even was in April to wear a facial covering when you're at a store buying things, when you're out in public. Doesn't mean you need to wear one in your own yard, doing yard work in your own home, but certainly when you're in public, very important. The life you save could be your neighbors, your aunt and uncles, your grandparents, your parents, and it could be your life that you save. So that's a very important item of personal responsibility. And frankly, we owe it to those who are working in retail and they're wearing masks and they're taking that additional risk that they're taking by being in that public-facing position. We owe it to them to keep them safer, to wear masks when we're shopping as well. Our more vulnerable Coloradans, older Coloradans, those with respiratory conditions need to continue to stay at home whenever they can. We also need to really, and we are, and we'll get into this in the testing description, really upping the bar on what we're doing to protect our most vulnerable who live in our senior centers and our nursing homes. And then the focus of today's presentation is enhancing the testing, isolation, and monitoring, a very important part of the modeling that's been done by Dr. Samet and his team for how Colorado can successfully get through May is the testing, isolation, and monitoring capacity. So Dr. Samet and his team modeled all of 4 of those pieces in conjunction with our all of the above strategy, which means staying at home for older Coloradans, better case detection and containment. And right now our epidemiologists estimate that we're identifying and isolating formally about 1/3 of our symptomatic patients within 48 hours. What Dr. Samet's model includes and is increasing that by 5 percentage points each week. The increases in testing far exceed that 5%, so we feel that's a good baseline to build off on how we can identify more of the symptomatic patients quicker to increase isolation services. And it's also important that every Coloradan know that if you are experiencing flu-like symptoms, that you remain at home and you self-isolate. That's incredibly important. Your decision to do that could absolutely save the lives of your loved ones, your friends, your neighbors, and your coworkers. And it's extremely important to do. We made provisions in Colorado law under executive order that you will get sick pay if you're unable to go to work for those 4 or 5 days, and then if it's confirmed to be COVID, 2 weeks of pay, because you have to stay at home. It's really important for you, for your family, for your coworkers, and for the public health in general. The more people stay at home when they're ill, the more we open quicker. It's simply that simple. And of course, wear facial coverings whenever you're in public. And we tested these models with different levels of social distancing within the general population. What we found is that if we can successfully maintain 65% social distancing, which is what our Safer at Home goal is, we won't overload the healthcare system capacity. We could also take it down to 55% eventually, but we want to see how we do at 65% first. And that dotted line was the healthcare capacity, and that's what is always important that we never exceed in our state. These are the raw numbers. What it shows is that if we can succeed, I should say I'm confident that you will succeed, and when Colorado succeeds in having 65% social distancing, it means that the peak ICU usage is behind us. It means it was April 21st. Now, there's room in there because we know that with this model, it could be as low as 55%. And what's key to know, at 55%, we still don't exceed our estimated 2,000 ICU beds in the state. It would get to 1,400 beds in September. We don't want that to happen. We hope we would notice that before and try to increase social distancing however we can. But even in that model, if we're between 55 and 65%, we want to make sure we're not exceeding the number of beds in the state. We cannot yet, the state cannot yet reduce that to 45%, or there would be the need for 4,100 beds. More than twice our current capacity. We're expanding capacity modestly on the ICU front. We will not be at 4,100. We're increasing more of the non-ICU hospital beds, and we could do a similar model with those, which looks similar to this, because one is really a function of the other. So keep in mind that this model only takes into account testing, identifying and isolating symptomatic COVID patients themselves. It does not yet take into account contact tracing, which we're increasing in conjunction with testing, which, if you will, provides additional bonus points for this model that'll be integrated into future models to show as we can scale up the tracing and the isolating of contacts, not just the person themselves, but everybody who might be exposed under quarantine to see if they develop the virus. That can allow for further opening of the economy and even more ability to do the things that keep Colorado special. So a little bit of where does that song go? So where have you gone? Where have you been? Where have you been? Where are you going? I'm not a singer. I'm just doing my best as your governor. And when the crisis began, we only were able to do 160 tests in the state of Colorado. Might seem like a lifetime ago. It was less than 2 months ago. Through making the process more efficient, through adding staffing, the lab capacity and our processing capacity has increased 20-fold in Colorado. We now have the private and state lab capacity to do well over 10,000 tests a day in Colorado. But we face significant supply constraints that are no different than the supply constraints that are faced in other states and other countries across the world. So our goal for May, and a lot of what we're doing with Safer at Home is really about May. While the stay-at-home formally expired April 27th, stores are opening their doors May 1st. It's really about what life looks like in May, and people knowing that it might be adjusted along the way. People generally want to have a sense. I talked to some of our venues today. I talked to museums. They all want to get a sense of what May looks like. So what May looks like, 5,000 tests a day, early May. Up to 8,500 tests a day or more if needed by the end of May. So in the May time period, what you'll see on average is 5,000 to 10,000 tests a day. For the month of May, starting out in that 5,000 range, getting up to 8,500 range towards the end of May. That's the plan. That's the supplies that we have the visibility on and the confidence on to be able to set those goals. And that's up from the about 2,000 to 3,000 tests a day that we have and have been running. So it's significantly increased testing for the safer at home stage compared to the stay at home phase, when effectively everybody was in quarantine. We're still asking those over 65 to be in quarantine to the greatest extent you can, to stay home except when absolutely necessary. But other folks are going to be able to go out and earn a living, which is incredibly important in our state in as safe a way as possible. And the increased testing, along with the tracing and isolation, is a key part of that four-part strategy about how we get there. Here's a visualization of our lab capacity. I think the main takeaway I want to show people from here is that initially the state lab had longer processing time, and there was a lot of frustrations. People weren't getting back results for 3, 4, I think for 1 week, even 5 days. That is now 1 day. So there's 24-hour turnaround, getting better. But for the last few weeks, it's been a day. 24 hours. It's incredibly important because the sooner people can get back test results, the sooner we can activate the tracing and isolation. And of course, anybody with the flu-like symptoms is supposed to isolate themselves, regardless of the test result. You isolate yourself. If you're sick, you isolate yourself. Test, no test, pending test results, don't expose it yourself to others. No matter what you have, right? If it turns out being the flu, you don't want to make people sick with that either. If it turns out being a bacterial infection, you don't want to make people sick with that. It turns out being COVID, you definitely don't want to make people sick with that. But yes, we've got that to a 24-hour turnaround period, very important. This doesn't include, we do have a very limited supply of the 15-minute tests. You might have heard a lot about those. They are a lot less accurate, to be clear, and that's been verified through numerous state labs. Doesn't mean they're not useful. They are. But whereas the overall testing has a significantly higher accuracy rate, depending on what platform is being used, it could be 90%, 95%, 85%. A lot of the work being done around the 15-minute instant testing shows it's more in the 70, 75% range, could even be lower. So there's a use for those, but this is not that. This is the main testing that's done with a one-day turnaround, and we're proud of the folks who've helped put that together. So I want to tell you a little bit how we're going to reach this goal here in our state of Colorado. We're going to, and we have been working on for weeks, increasing the supplies and the reliability of our testing supplies, increasing the availability of testing statewide, how we're doing that, and the epidemiological capacity and impact of that testing. I mean, it's not just about the testing, it's then about how do you follow up, make sure anybody who tests positive is not isolating, but not only that, make sure that those who've come into contact with them are notified that somebody that they worked alongside of or saw recently is positive and that they need to isolate themselves to see if they develop symptoms during the incubation period. So their testing really has three key roles. First one is identifying people who have COVID-19, who, if you're ill, stay at home and don't expose others, but we want to know who has COVID-19. The second one is identifying hotspots. It's interesting, one person, two people, three people have it. What's the connection? Is it 6 people that work at a particular company that have it? Well, we may need to have additional actions around locking down the company to prevent having to lock down the entire county or the state. We want to deal with this at a site-specific level going forward. The role of testing is critical in identifying those outbreaks early and acting quickly and boldly rather than letting it result in county-wide or economy-wide overarching shutdowns. And of course, the role of testing and protecting the most vulnerable. And this generally means our senior living facilities, our nursing homes, they're staffed by a lot of folks. And because about half the people who contract COVID-19 don't exhibit symptoms, but are still contagious, we're really focused on testing asymptomatic workers. That means people that feel fine. They don't have any inkling they might have it or be contagious, but are going into work with people in their 70s and 80s and 90s. We want to test them before they have symptoms so that they're not spreading it to a group that has a much, 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 much higher fatality rate than younger and healthier Coloradans. So there's 2 types of testing, and this is very important also to talk about because when people say testing, they mean different things. And you might not have heard this from anybody yet about the 2 types, so I want to describe what those are. There's swab sampling, which is really the main basis of what we're talking about here today. Currently, it's a nasal swab. We're also working on saliva. The virus is also present in saliva. The second is a blood test, anywhere from a drop to a tube, but that test is for the antibodies. It is the nasal test, the swab test, we hope saliva soon, that's been validated in some areas, is the only test that tells you if you currently have the virus, right? So the swab sampling is critical because it tells you if you currently have the virus. And at this point in the pandemic, the swab test and the increases in capacity on the swab test is absolutely crucial to ensure that infected individuals are isolated and those who've come into contact with them are also isolated. And that's the test we're focused on today. We're going to talk a little bit about the blood test, or what the fancy word is serological testing, but mostly we're going to be talking about the swabs. The serological or blood test shows if your body has produced antibodies in the bloodstream to fight COVID. But you can't just rely on the blood test because you may have COVID right now, you may have had COVID and have overcome it and no longer be contagious, or you may have just contracted COVID and you may not have the antibodies yet, but it would show up in the swab test. It's also important that consumers know the market has been flooded with inaccurate and insufficiently validated blood testing. And people should be aware of those. People can do them if they want in our state, and there's folks that are offering them in different ways, but it doesn't tell you whether you have it or are contagious. And that's important that people know that. And we also don't know the accuracy rate of the different blood tests that are occurring. Just as on the swab side, there's a wide variety of accuracy rates depending on the test. And that's why we have different places and ways that we use the more accurate tests and the least accurate tests. We're going to use every test we can get, but we have to use the more accurate tests in the most sensitive settings. It really is the same with blood tests. So the blood tests are helpful because they give us important epidemiological research, outbreak surveillance, scientific research, and it can also be used to screen the blood of those who've recovered from COVID, who can then donate their plasma for scientific research on a cure or vaccine, and we certainly hope that works. So we don't yet have enough data to know what antibody tests mean for individual patients, but Colorado is really spearheading research in this area. Here's, this might look daunting, but this is actually a lot simpler than you think, this graph. What we call viral RNA, that's what we pick up in the swab test. So you see that peaks early. A few days into your infection, the nasal swab test will pick it up. The LGM, or short-term antibodies, LGG is long-term antibodies that last for months. So when you're picking up those, you could pick up somebody who's in the middle or late phases of their active infection or well after their infection. And this is the recovery of symptomatic individuals. Some people are asymptomatic, but those who are symptomatic can recover in a matter of days, or in the more severe cases, a matter of weeks. During that time, they have the active viral RNA that's picked up by the nasal or saliva swabs. And they are developing those antibodies, which will provide visibility into who had it, and we hope offers a degree of protection. And that's the other variable in this. There's not yet conclusive science about how protected you are by antibodies. We don't know exactly how long any added protection lasts, and we don't know the degree of that added protection, right? Scientists generally believe that it confers some added protection, but it's unknown whether that's a high degree of protection or a medium degree of protection. There's been a number of documented cases of reinfection. It's similar to when you get, let's just look at this, you might have gotten the flu shot, you might have gotten the measles shot. Flu shot only has about 50% protection against the flu, right? I got one, I wanted to be protected. Certainly it's 50% less chance of getting the flu. I don't get one every year. Some years I just didn't have time, didn't do it, but I did get one this year. I got one last year. A measles shot, about 90% protection. So there are people who still get the measles shot and get measles, but they have much, much, much higher protection. And then secondarily in some of these, and again, we don't know if this is the case with COVID-19, but it is with others, sometimes the cases are less severe if you have the antibodies as well, even if you do develop a second infection. So this is all very promising. Many entities around the state are spearheading critical research to see how the blood testing can be used. There's a series of studies that are looking at, these are happening right now in Colorado, a longitudinal study looking at the rate of infection in Colorado over time, a study seeking to understand the role of children in transmission, very important as we prepare for our schools to open in the fall, a study looking at infection rates in different communities, a study looking at exposure among frontline healthcare workers, and a study looking at exposure to senior care workers. Again, not the work we're doing to do the nasal swabs to see who's contagious today, but just that scientific work about who might have had it at some time and has overcome it and might have increased resistance. So these are very important efforts. It's very promising. CU and CSU are developing their very own ELISA antibiotic blood test and new testing techniques. Laboratories across the state are working to validate different commercial tests that are on the market to make sure that they're accurate. It's all promising, but the nasal swab is the more relevant way to test, and unfortunately it's more complicated to test. Harder and more costly to test, but more important in terms of reining in the infection rates in Colorado, part of our 4-tier strategy for the month of May. And I want to walk you through the unique challenges of what a test even looks like. I'm going to walk you through what supplies are needed for testing, and when we talk about testing, kind of what we're talking about in terms of equipment and staff. First, you need a trained professional that's fully decked out in personal protection equipment. That means that for anybody who's doing testing, they're wearing gloves, they're wearing goggles or a face shield, they're wearing an N95 mask, right? That's not this little mask that I wear around. This is the mask that that actually it extremely effectively filters out virus. Even if somebody were to cough on you with the virus, it would significantly reduce the likelihood of you being exposed directly. You still have to avoid the surfaces that they touched on. And of course, this is a gown. So those are the items that are needed from the personal protection equipment side. Second, the professional needs to use a collection kit to take a sample. These are the nasopharyngeal swabs. Think of it as a long Q-tip. They are also validating, and for many tests, something that's a lot closer to a normal Q-tip. So normal Q-tips, extra long Q-tips, and saliva in some cases going into the testing medium here, which saline also works for in most cases. This has been another factor of simply acquiring these, right? So for some tests, sterile Q-tips. for some tests, these long nasopharyngeal swabs, and then some form of transport medium here, saline or other transport medium. So this has been another area that we've been focused on, making sure that we have the supplies to do the testing that we need as well in the state of Colorado. Third, you need to transport the sample to a site where you can actually extract the RNA. This is at a commercial lab or our state lab. They also need extraction reagents, and this has been a limiting factor as well. We're not yet able to manufacture these in Colorado. There's folks in any scale. There's folks that are working on gearing this up. This particular one is from Germany, and this particular one, I believe, is from, well, it doesn't say. But we've imported these from a number of different places: South Korea, Germany, United States. Taking the sample of the test without the reagent provides no way to analyze the result of the test. So that's the next piece that they need to be able to do it, is the extraction reagent. Fourth, once you've extracted the RNA, you need a reagent to detect whether or not the person has COVID or not. That's essentially the test itself, if you will. And of course, for both extraction and detection, you also need highly specialized medical equipment. Here's an example. Our state lab and private labs and providers and a few dozen sites throughout the state have the knowledge to do it, but the supplies have also been constrained, and this one is manufactured by Gilson, on being able to get through the backlog on the supplies that are needed for the testing as well. We will invite the cameras and members of the press to look at this table and take pictures of these different items later. We've been focused on making sure we have enough of all of them to meet the very aggressive testing goals that Colorado has. There is one more thing. It's about the machine. I didn't bring one in because guess what? We're using them all. And they're also large and hard to move. So when we talk about testing supplies, it also means a testing machine. Here's an example of one of them, a real-time PCR instrument that once you have the testing reagent, the extraction reagent, the transport medium, the sampling done safely, this is where it all occurs. And this all occurs from gathering to processing in 24 hours in most cases. And it's an amazing job that the folks at both the private labs and the state lab are really doing around this. So the test is complicated. Supplies are limited, not just in Colorado, not just in America, across the globe, because everybody is trying to buy them and scale up. And that's why this has been such a challenge for Colorado and for America to get where we know we need to be on testing. And I'm proud to tell you that I'm optimistic that we are getting where we need to be. And I'm going to give you an update on where we are in terms of the testing supply numbers. Keep in mind, as I present these numbers, it's a snapshot of a constantly changing situation, because as soon as we get our hands on something, it's distributed to ensure more testing. It goes in, it goes right out, and we always have a number of different irons in the fire to do even better, but we have a high degree of confidence that these numbers that we're presenting today either have been delivered, will be delivered very soon. Yesterday I was on a call with the White House where we worked on our statewide testing plan, and we were promised 195,000 swabs during the month of May, 195 viral media, also facilitating our purchase order from private companies to purchase the extraction and detection reagents. This includes some of that. It's not the only source. We also have made purchases of these in the open market. So where we are today, about 15,000 swabs, 20,000 units of extraction reagent, 100,000 units of detection reagent. That was from South Korea, already arrived, been validated, ready to go. By May 11th, and we hope sooner, federal government told us the first week in May it should go out, so just being cautious in terms of our plan for May 11th. We expect to have 147,000 swabs, 117,000 sufficient reaction reagent for tests, and 147,000 detection reagents by the end of May. And this would be active for the last week in May. We expect to be at 195,000 in all categories. So I want to take a moment to thank our innovation response team for their work, and Sarah Thunberg and Casey Wolf and Kyle Brown. I want to thank for really being able to work with the federal government, with private suppliers, to be able to help Colorado reach these very aggressive goals, which are a very important part of us being able to have a successful May. I point out that these figures are higher than the baseline that was built into the model that Dr. Sam had prepared that showed a 5% per week increasing in testing and isolation. So that was the baseline that we wanted to build, a conservative case into that model. But with the numbers I'm presenting today, as you can see, we really expect that Colorado is going to do a lot better, starting the month of May at about the 5,000 per day level, getting up to the 8,500 plus level by mid to late May, really averaging 5,000 to 10,000 throughout the month of May per day in different settings in different ways. And I want to talk a little bit about the increasing the availability of testing. To hit our goal, we need to provide a variety of sites across the state and meet people where they're at, right? People don't want to drive an hour and a half to get tested. They don't want to go to a place they can't get tested and be turned around. And so we're doing an all of the above approach to bring testing to people. One is, of course, private sector hospitals and healthcare facilities. And that's one of the main places that patients interface with medical professionals. It's a big part of how we're going to deliver these services, not the only way. The second way is local community-based testing sites, and we're doing these across the state. I'll talk about a few of those, and that program will continue and accelerate. The third is targeted testing for outbreaks in at-risk population. This is generally the testing of asymptomatic folks. Now, there's millions of Coloradans. They're not everybody who doesn't have symptoms isn't going to be tested, but it'll be prioritized for people that are going to work with folks in their 70s and 80s, people that work in nursing homes, people that work in senior care facilities. We've done a bit of it already, and that's going to be rapidly accelerating through the month of May to prevent further outbreaks at those facilities. And then, of course, the state collaborates with private sector partners in a variety of ways around that testing. All of that information is fed back to our command center, so we can provide the public with current data and ensure that we're directing our resources and our health policy decisions based on science and data to actually meet the needs on the ground and contain outbreaks earlier rather than later. Here's a few examples of what each of these look like, because you're hearing these terms and what does that mean? Healthcare settings. This is where testing is being done. Children's Hospital, National Jewish, Denver Health, UC Health, Centura, Stride, Clinica, Community Health Centers, Kaiser Permanente. It's being done across the state at hospitals. Local community testing sites. We distributed a playbook to every public health agency in the state to support them in their testing. 51 counties in our state have requested a site. We've already completed readiness assessments, and we've approved 34 counties, and we've already sent testing supplies out to 26 of those community testing sites that are run by our local community partners across our state. And then the state is running our own mobile testing as well. In Weld County, we now have tested a number of people, and it was in Pueblo and El Paso and other areas as well. We're also helping through private sector partners, King Soopers, already doing testing at Auraria campus. They're opening their site in Boulder at King Soopers as well, where we're already talking to many other potential private sector partners and pharmacies that make it more convenient to get testing done. And then, of course, our state and county public health authority. I mentioned the last few days in Weld County, testing 882 people. Already found 124 positives. So, and 34 of them were asymptomatic, right? People that might have spread it to others without knowing if we didn't make them alert as to their status. We've been in Pueblo, we've been in Mesa County, we've been in El Paso County. The Colorado National Guard and others are working very, very hard to make sure that we can provide that free testing. And by the way, all of this testing we're talking about, or at least almost all of it, is no out-of-pocket to consumers. And I say almost all of it because some of the serological testing that's optional, if you don't meet the criteria and you want to get tested, there may be a charge. But all of this testing that we're talking about here, there's no out-of-pocket to consumers, and that's very important to note as well. We will continue with the next slide. So testing update on senior facilities. 4 facilities tested, 1 ongoing today. It's 1,100 tests just in the last few days. And again, we found 99 total positives, 33 were asymptomatic. So the symptomatic should have been staying home anyway, but the 33 asymptomatic, that's folks that we were able to prevent from going to work at nursing homes and senior care facilities, and each one of those could have led to an outbreak that could have cost the lives of tens of our vulnerable seniors that live in those facilities. Working on a new partnership with CSU to run 45,000 tests on nursing home workers. That's in addition to the work that's supported by the Colorado National Guard. Big priority. And then personal protection equipment being sent to nursing homes by May 1st. 85,000 masks going out to almost every nursing home in the state. 388,000 gloves. 7,800 gowns, and eye protections, 10,000. So in case there are some asymptomatic folks that didn't get tested or became positive after they were tested, they're still going to be using those precautions. We want to do everything that we can to keep the folks safe that are living their golden years in retirement and make sure that they're there for many years to come for their families, for themselves, for their friends. And we can't wait until our senior friends can go back to bowling leagues and movie nights, and that's not in May. But we want you to be there. We want you to be there when we celebrate that date. So I know it's tough to stay at home if you're 75 and healthy and you want to go out and go to dinner with your friends and go to your bridge club. But not yet, not yet. And we want to make sure that when that day comes, you're with us, you're healthy, and you have many great years ahead. Who gets tested now? Anybody with symptoms who's a healthcare or frontline worker, people with symptoms who are hospital and nursing home patients, workers and others in outbreaks, some symptomatic community members. If you are sick, you should stay home. There's no treatment for COVID-19. There's many experimental treatments, but 9 out of 10 people just get better on your own. You self-isolate. And if you need medical attention, if you're having trouble breathing, you, of course, should immediately call 911. But otherwise, you will likely get better, and you need to do that in your own home and avoid contact with others. And on a scheduled pilot basis, as we talked about, we're testing asymptomatic workers, over 1,000 in the last few days at our senior care facilities. Who can get tested in a few weeks? That's also important because it's expanded. It's more folks with the increase in testing. Symptomatic healthcare and frontline workers, of course, the hospital and nursing home patients, all symptomatic community members who want it is the goal when you're at that 5,000 to 10,000 a day range. If you have symptoms, you can get tested. Doesn't mean you have to or you want to, right? I mean, if you're sick, 9 in 10 chance you won't need hospitalization. Isolate yourself, get better. But that it'd be increasing availability is good because I know a lot of people, while there's nothing they can do for it, a lot of people want to know whether they had it or whether they had the flu or whether they had something else. Sometimes that's important for what you might have that's not COVID-19, right? Perhaps, for instance, it's a bacterial infection. And perhaps you need antibiotics for the bacterial infection. We don't want that to go undiagnosed because you think it might be COVID-19. Right? So there's a lot of benefits, whether the benefits are almost exclusive if it's not COVID, actually, to getting testing, because there's nothing they can do for you if you have COVID. But there are benefits if it's non-COVID-19, if it's not coronavirus, it might be something that's responsive to antibiotics. Your doctor might give you a prescription. There's other tests for those. So there's a number of things that are important there. And then on a scheduled basis, we're increasing the testing for workers that are perfectly healthy that work at our senior care facilities. Really a robust program to prevent hotspots, reduce the likelihood of hotspots in long-term care facilities and nursing homes, among other vulnerable populations, including people experiencing homelessness as well. And as we're committed to scale, we're really building that program to be robust and strong to meet Colorado's testing needs, knowing that testing alone doesn't meet our goals for May. It's one of the 4 areas that we need to have successful implementation on. Protecting our most vulnerable, testing is a role in that. It's not the only role, but it's part of the role. Continuing social distancing and wearing masks in public, and of course anybody who works with the public needs to wear masks as well. So we're still working to get that infrastructure in place. Here's kind of an update of what we're working on. That means partnerships with private and public sector to have more testing sites. And, we're building this car as we're driving. It's a labor-intensive effort. There's a lot of good folks in the private and public sector collaborating to achieve this. And we know that we need to continue to process tests and then make those tests more meaningful. And that's what I want to talk about now. That's the epidemiology team to contain the spread of the virus more. Now, we've doubled the epidemiology and contact tracing team in the last 2 weeks, from 31 people to 56 people, and it's continuing to go up. We're also building a first-in-the-country COVID Navigator program that establishes wraparound support for those who are sick, meaning telling people to self-isolate is one thing. Having 90% comply versus 50% comply with staying at home for 14 days, even if they're feeling better, even if they're asymptomatic, we know that's hard, but that's what people have to do, and we're going to have the team and support structure and the Navigator program in place. Some people need food delivery to their door to successfully stay home. Some need to talk to people and to socialize virtually. Some need cable. Whatever it is you need, we want to make sure that we're able to achieve that for you so that we have among the highest rates of successful compliance with isolation in the country. For this strategy to work, that's absolutely critical as well. And if we want the best epidemiological response, it requires more than just staff. It also means bringing all the technological tools that we have to bear. So in partnership with Google and MTX, we've already launched our new symptom tracker. It's called cosymptomtracker.com. Over 1,000 folks have already entered their symptoms. A lot more are going to be doing this after the businesses go back, because one of the main interfaces in our guidance for offices that are reopening May 4th, 4 days later in the Denver metro area, they're taking people's temperature above a certain size. If you work in one of these office buildings, boom, that temperature is elevated. You go right into the CO symptom tracker, right? Whether it's COVID or non-COVID, we can identify hotspots early, meaning, oh my goodness, there's 11 cases that are connected to this office building. Rather than risk locking down the entire city or county or economy, we need to lock down and isolate those who work in this particular building because they might be at increased risk. We can also refer people to testing sites and get them quicker contact tracing through that. There's rapid scale, and there's more data that's available quickly to folks that be a meaningful part of the response. This sort of self-reporting is already happening across our state. Over 1,000 entries into the tracker. It's already giving us valuable information, even more so as people are returning to work. The tracker has a short survey where you can submit your symptoms, and you can opt into text message support if you want to, which directs you to various resources from telemedicine to behavioral health support. We're also collecting data from emergency rooms on patient symptoms so we can track which communities are the most impacted. It's one of those early warning systems. CO symptom tracker, the data from emergency rooms, early warning symptoms to get on some of those outbreaks earlier rather than later, followed with the increased testing surge in that area to find out what's going on the ground, followed by additional actions to keep people safe at a site-specific level or a local level, rather than these overly broad statewide actions. All of these things work in concert to help us achieve success in the month of May. More testing, more test sites, and more epidemiological capacity. And together with Safer at Home, and that includes the vulnerable population staying at home during the month of May whenever they can, wearing face coverings, and continuing the social distancing and good hygiene, washing our hands regularly, we can continue to make progress in our fight against this deadly virus and hopefully be able to remove even more barriers more rapidly that hold us back from psychological, emotional, and economic fulfillment in our state of Colorado. And that's certainly the goal. I also have an important announcement around health equity in Colorado. The racial data that we're releasing shows communities of color are more likely to suffer from COVID and coronavirus and the impacts of the disease. And that can be a proxy for other social inequities, and they often impact people's ability to deal with COVID. So a couple weeks ago, we announced we're setting up a coronavirus health equity response team to ensure equity is a factor in decision-making, making sure that as we increase access to testing and care services, that we are also doing so in our communities of color. Ensuring racial and ethnic data is available, transparent, and really helps inform decision-making, as well as sharing time-sensitive information in a culturally relevant way with different diverse Colorado communities and their particular challenges that they face. The team's headed by Webb Brown, and today we're glad to announce all of the task force members. I'm not going to read through them all, but I'm very honored that my successor in the 2nd Congressional District, Congressman Joe Neguse, is going to be the congressional liaison to this important and diverse body with members from across the state. It's also crucial to remember that no matter your race or your background, we are all in this together. And this virus makes no distinction. No one is immune from this virus because of who you are, your background, or your age. And that means we all have a responsibility to protect ourselves and one another. We all have a responsibility to take this deadly seriously, to stay home when we can, to wear masks when we're out in public, to protect and help our most vulnerable neighbors, and maintain social distancing when we're out. Do everything that we can together as a state to weather this storm. We've been through tough times before. We'll be through tough times again. But I know that we're going to get through this, Colorado, and we're going to come out the tunnel on the other side more unified than ever before. I'm going to start with a few questions from the general public, as I'm beginning to do at these. These are submitted through Facebook or Twitter. I can't answer all of them. We answer a few online, but I'm answering a few in person as well. Let me see here. First one is, the Constitution matters, protect the vulnerable, the numbers do not bear out this safer at home business, open the state. A lot of Coloradans have that perspective, and we are opening the state. Retail stores will be open, offices will be open. Doesn't mean people can run out to Rockies games, even if we were to let them occur, which we're not. Major League Baseball is not ready to play. They're talking about opening to empty fields and empty stadiums. So we want people to be responsible as there's a phased-in approach to more opportunities for Coloradans to earn a living. It's very important that businesses follow those safety guidelines. But businesses always follow safety guidelines, right? If you got your hair cut in good times months ago, they have guidelines they have to follow around sterilizing their equipment, preventing outbreaks of hepatitis or other infections. There's additional precautions that they're going to be taking, including wearing masks if you choose to get a haircut after they open on May 1st or May 8th in the Denver metro area. Another person said, there is no fair or just way to decide which businesses or activities are essential to someone else. That has been the problem all along. The things I do are essential to me. They may not be to someone else. The government has no right to pick and choose which business survives this, but they are. It's disgusting. So no businesses were targeted or impacted based on what we think their value is to Coloradans. Every transaction between two individuals who engage in a willing transaction benefits both parties. That's the nature of the market system that we live under. But there are some that were simply too dangerous, not because of what they do or what they are, simply because by nature of being a nightclub or a bar, it involves rapid socializing between dozens or hundreds of people together, where one infection can lead to dozens or hundreds of infections, right? And some of those hundreds at that bar and nightclub might be the caregivers for their grandparents, might go on to give it to their elderly neighbors or at their church. So it's all about what's safe. Nobody in government or anywhere else is trying to tell anybody what's essential and what's not. Everything you do is essential. Every Colorado consumer, every Colorado business, every Colorado worker is absolutely essential. It's just about having, as a society, the social distancing that we need to avoid completely overwhelming our hospital system and having unnecessary loss of life, meaning people that contract the virus would survive with oxygen or a ventilator, but die because there's not one there for him. Finally, one more. Sadly, there's a small and vocal minority encouraging others to engage in unsafe activities. Just mandate masks already, and at least there will be that protection. And I hope that everybody acts responsibly in this epidemic. And we did just recently, about a week ago, we did mandate masks for anybody who is working at a store, and this will carry across to all the stores. It's currently the critical retailers like grocery stores. Anybody who works with the public, faces the public, needs to wear a mask. Now, I'm also very supportive of businesses implementing policies. We often say, no shoes, no shirt, no service. Well, absolutely. Individual businesses can inspire increased customer confidence and safety by saying no shirt, no shoes, no mask, no service. And many other communities across the state are also implementing measures that they're able to enforce to make sure that customers also wear masks when they're shopping or engaged in interfacing with others in public. And I'm very supportive of those measures that cities and counties across our state are also pursuing. So with that, I would be happy to open it up and take some questions. Yes.
Governor, I know that fighting COVID, wearing masks and social distancing is very important, but I'd like to ask a question that you raised about testing. You're saying that by the end of May, you want to conduct 10,000 tests across the state, and you said that currently there are only 2,000 to 3,000 tests being done. What makes you so confident that Colorado will be able to test so many people by the end of May when you mentioned that there might not be the agents and other things that are necessary to do so?
So the question was about how can we be sure about reaching our testing goals of 5,000 to 10,000 throughout the month of May, start May, early May, 5,000, getting up to 8,500 a day on average by the end of May. I hope that I gave folks more visibility into this work that we've been doing for many, many weeks to line up the supplies that we needed during the safer at home phase to be at 5,000 to 10,000 tests per day during the month of May, starting around 5,000 a day, getting up to about 8,500 a day by the end of May, more if needed. That's what we have been working on for many weeks to make sure that Colorado has the supplies, all of the supplies, the personal protection equipment, beyond what's needed by our frontline healthcare workers, beyond what's needed in our nursing home facilities to be able to do testing, the reagent, the swabs, all of those pieces of equipment that come together to make sure that we can start out May 5,000 a month and be at 8,500 plus by the end of the month and continue that pace of growth. And I would also point out that that is a higher rate of increase on testing than we built into our models. We were more conservative in our models because we didn't know what we will arrive when. Now that we received the over 100,000 tests from South Korea, we feel better talking about that. Now that we have the verbal commitment from the federal government for the delivery of additional supplies during the month of May and the timing for those, we feel a lot more confident, and we'll be updating those models in ways that might allow for reductions in social distancing over time. And if things are moving the right way, we hope there's additional areas that can open throughout the month. Telephone question, please. Well, I look forward to examining that federal order with a fine-tooth comb, consulting with our Attorney General, Phil Weiser, as well as our counsel, to find out how Colorado will not shirk on our responsibility to keep workers safe. I was on a call with the Vice President this morning about the food industry and Secretary Perdue, along with our terrific Agriculture Commissioner, Kate Greenberg in Colorado. And I also made the point that if there's the expectation and the need to protect our national food security, and while we're grateful for the federal government's commitment of shipping and sending personal protection equipment en masse to our food facilities, they need to accompany that with a specific testing commitment. So rather than face closures in the future, workers can be screened and tested, healthy workers can return to work, and workers who test positive can remain in isolation for a period of time. It's much better for both the workers and for our food security to just remove the 5 or 10% of workers that might be positive from the workforce rather than have to close the entire plant for an extended period of time. So we look forward to continuing to work with the federal government and others to protect Colorado workers. And I will not let any executive order stand in the way of us protecting people in Colorado and also managing the reliability of the food supply, which is also an important economic engine of our state. Yes?
Governor, you yourself said that testing doesn't mean much if you don't have contact tracers to back it up. You talked about 56 contact tracers in the state. Massachusetts has moved to hire 1,000. Are you confident that Colorado is anywhere close to having an effective contact tracing force?
So a lot of our work around the West was about contact tracing and how we're scaling that up. First of all, Massachusetts, I think, talked about where they want to be. We're talking about what we've done and where we are. So we've already doubled the number of epidemiologists. What's that? Well, we're talking about what we've accomplished already. So I think we've had a faster ramp up than Massachusetts in epidemiologists. We already have twice the number that we had just 3 weeks ago. Incredibly fast increase. And then we're also doing the first of its kind online symptom tracker, already live, over 1,000 entries, as well as the additional work through Google and MTX. Because what we're doing, it's not just the high-touch traditional way of doing it. I don't think Massachusetts can successfully scale up that number of epidemiologists so fast. There's not the infrastructure to do that. There's not the available workforce to do that. That's why we are looking for online effective ways to do that through our apps, through our online systems, accompanied by that traditional epidemiological work, which continues to scale up and has already doubled in size in Colorado.
Quick clarification question. When you're referring to tests and I assume about Colorado, California, and I'm curious whether you've reached out to the and how.
Sure. So yes, those numbers that you saw, while we talked briefly about serological testing, all of the numbers we're talking about are for nasal swab testing or saliva testing, which will become increasingly prevalent, we hope and expect, throughout the month of May. So that goal of being at 5,000 a day for early May, 8,500 a day by the end of May, really in that 5,000 to 10,000 range throughout the month, is where we will be at with regard to the actual viral RNA testing, who has it today, not who had it last week or last month. We are watching all the interesting work on the blood testing, the antibody testing, but that is mostly scientific work at this point. It guides our information, it guides our decisions from an information and science perspective, and it's very helpful and complementary, and there's a number of studies being done, but it doesn't have that immediate containment benefit that the work around the swab testing does. I talk regularly with the governors of our neighboring states. It's very relevant, in fact, what Utah, Wyoming, New Mexico, Arizona, Nebraska, Kansas are all working on, Oklahoma, are all doing great work in different areas. Many of them didn't have to have the same kind of stay-at-home period that we did. And that's just the fact that they had less of an outbreak than we did. Colorado has always been kind of just south of being one of these national hotspots, and I'm grateful for that. We don't want to have been a New York City or a New Orleans or a Chicago. We've always been one step down from that, which means that we've done what we needed to do. Colorado stayed at home successfully 32 days. I'm really thrilled that residents of Utah and Nebraska didn't have to have a stay-at-home order for a single day. They went right to kind of this safer at home type period that we are now in, but we're only here because of the hard work of the people of Colorado. So we look forward to continuing to work to scale up testing as rapidly as we can. Colorado will continue to be a leader in this area, 5,000 to 10,000 tests per day during the month of May. And we're working with our private and public partners to do that. We tested 1,000 people the last few days in Greeley. We continue to provide that surge capacity to be able to get on hotspots quickly. And we were also, I think, one of the first 3 states, along with New Mexico and California, to do the testing of the asymptomatic workers at senior care facilities. Over 1,000 tests already, several dozen asymptomatic individuals who thankfully will not bring the contagion unwittingly to those facilities where it could have a deadly result. Telephone, yeah, or here, in person, Jesse.
About how you're going to manage all these asymptomatic cases in the state. You're saying by May 15th, people who have symptoms will be able to be tested, but we know that as many as half of the people who have this virus will be asymptomatic. Isn't it going to be catching up too late by the time these people have already infected other people and these outbreaks have grown?
He asked about the asymptomatic people and how do you test them. You can't really pull them out from the rest of the population. They don't know they have it. You know, if people have minor symptoms, they might know that they should be tested, but otherwise, you simply don't know you have it. So there's only going to be targeted testing of asymptomatic individuals. What does that mean? It's the people who are perfectly healthy that go into work with people in their 70s and 80s. Because we don't want them, and they don't want, to bring that in unwittingly. And so we're increasing that capacity. We've tested over 1,000 already, but that's only as good as this week. Those same 1,000 people that got tested this week, many of them will have to be tested again in 8 or 10 days because more of them might unwittingly have the virus. So the asymptomatic testing will really be targeted to people who operate and work around people in their 70s and 80s to prevent the likelihood of the outbreak reaching even more and greater number of our senior care and nursing home facilities in our state. In general, it'll be the symptomatic Coloradans that are tested if they want to be. Again, if you're sick and you can self-isolate, stay at home. There's no clinical benefit to you in knowing what you have, unless it's something that's not COVID, then you probably do want to know if you need antibiotics for strep throat or something like that. But there's different symptoms for some of those conditions, and that's why we've also put a big push on telemedicine. I think it's important to talk to your doctor and see whether they think it's something other than COVID, because then it is very important to go in. You get tested for COVID, obviously to rule that out, but also tested for other conditions that there might be treatment for or could be even worse if they're not treated. Telephone?
Hi, Charles Ashley from the Grand Junction Daily Sentinel. I realize the topic of the day is testing, but I want to change the subject a little bit if I may. With the legislature coming back in the next, within 2 weeks, obviously their biggest discussion is going to be how to balance the budget, cutting about $3–4 billion, which means there's not going to be a lot of money for programs. I'm wondering what your priority is going to be when it comes to the recovery in helping to, find programs to create jobs, do things to boost broadband, which we've seen now that helps in business recovery. And what are your thoughts on non-monetary programs such as the Rural Jumpstart program? Should those kinds of things go forward? Should that be a priority for you?
So the biggest piece of business that the legislature and the Joint Budget Committee and all of us need to accomplish is the budget for next fiscal year. And that will be based on the projections that come out May 12th, the baseline projections that it will be balanced to. So that's a very important date that we'll all be looking for, and we look forward to working with folks to get that done. There will be capacity for additional non-fiscal work that the legislature does. Some of that were bills that were already in process that are good ideas, and some of them are even better ideas during a COVID-19 outbreak. Others are new ideas of areas where we can provide regulatory relief in statute that allows companies to operate in safer ways, allows individuals to live in safer ways. We have been working closely with legislators of both parties. We created an Economic Recovery and Stabilization Council chaired by former Denver Mayor and Secretary of Transportation Federico Peña, many members of the business community, Republican, Independent, Democrat, all working together to come up with common sense suggestions. Each of those areas and subcommittees has a Republican and a Democratic legislator working with them. So we think there's going to be some COVID-19 specific health and economic response pieces that we hope the legislature is able to find time for in their limited time that they're coming back. Yes?
Two quick questions from two of our reporters back at the station.
Can you speak a little louder, please?
Yes, two questions from two of our reporters back at the station. First, regarding the budget also, what kind of impact is coronavirus having on the state's budget, and what kind of cutbacks do you think we can expect to see due to the downturn in revenue?
So the budget forecast will be out May 12th. It's fair to say that just as the private sector and households across our state are tightening their belts, the state will also be tightening its belt, just as local governments will. We're very grateful for the federal government for their assistance in that. We hope that there's additional support on the way for our critical health and safety related government functions. But there's going to be a belt tightening across our entire state, and just as families are making sacrifices, state and local governments are also making sacrifices.
Question regarding the eviction notices that were placed on the gate of the governor's mansion. Are you aware of those notices? Are you aware that there are some landlords who are still trying to evict tenants who can't pay their rent during this difficult time?
Well, I don't think there have been any evictions in the month of April. That executive order is due to expire in the next few days. I will be renewing it and strengthening it, so there will also not be any evictions during the month of May. The only caveat on that is there are emergency evictions process for dangerous situations and health and safety. If there's somebody that's brewing meth in a house, they will get an eviction notice. But there will be no evictions for lack of payment for May, just as there have not been for April. Yes.
Buenas tardes, gobernador. De acuerdo con un informe del Eviction Lab, Colorado está entre los estados con menos protección contra los desalojos durante la pandemia. ¿Qué planea hacer para prevenir estos desalojos que ya están sucediendo con la comunidad latina?
Estamos contemplando renovar y expandir la orden ejecutiva en los próximos días para proteger a personas quienes están alquilando sus lugares y sus casas. Telephone? Sí.
Gobernador, las personas que no han podido pagar sus rentas e hipotecas siguen haciendo un llamado para que usted genere la orden ejecutiva. ¿Usted va a generar esta orden?
Sí, es casi el mismo, ¿sí? Ok. Sí, en los próximos días vamos a renovar y expandir las protecciones para gente que están alquilando sus casas y protegerlos durante el mes de mayo, igual que el mes de abril. From the room? Yes.
Clarification on one point. The 150,000 kids from South Korea and the numbers you showed earlier about May and where we hope to get, is that included in the goals you set, or is that on top of that 150,000?
Those are the goals for testing for May. It'll be 5,000 to 10,000 a day throughout May. In the 5 range early, getting up to 8,500 by the end of May, but it'll be in that 5,000 to 10,000 per day range throughout the month. That's a sustained rate throughout the month. So we would, and we have additional purchases from South Korea that we will be expecting. Those are mostly for June. The ones that already received will be used in the month of May. Okay, from telephone, please.
Hi, Yesenia from Chauncey here. School district districts are planning large in-person events like graduation for as early as July. Do you have any guidance on what those might look like or if they'll be permitted?
The question was about how school districts are doing large events. I have regular calls with our superintendents. We simply don't have guidance for July yet. We have guidance for May, and they're not able to have those large gatherings in May. We certainly are hopeful. We know that there are graduations and kids want to have meaningful rites of passage, whether you're graduating 8th grade or graduating 12th grade. It's very important for families, and I'm happy to say for our graduating seniors, first of all, congratulations. Second of all, you're going to be able to have a graduation. It might not be the same date as your original graduation, and it might not look the same. But we're going to work closely with county health departments and school districts to have those, whether it's midsummer, late summer, or fall, whether it's virtual. We want to make that meaningful and complemented later by a physical get-together a few months later. I'm going to work closely with all of our principals and teachers and superintendents to make sure that students who've worked hard to earn that rite of passage and that diploma get to have the right kind of commencement ceremony so we can honor you along with your friends.
Governor Polis, this is Lori Lizarraga with 9 News. Congratulations on the update. I know it's a big one. And you mentioned earlier that 45,000 tests are going to nursing homes for the staff there. Will we be privy to how many of those are positive that come back also asymptomatic, like you were able to give us today? And then should nursing homes and long-term care facilities expect to continue to have state help with testing, mass testing like we saw at these 3 facilities last week? Or will they be responsible for testing on their own? Yeah,
so there's 2 ways that we're doing testing of non-symptomatic workers at our senior care facilities, and those who have symptoms get tested too. But the biggest benefit is a non-symptomatic, because if you're sick, you should be staying home anyway. If you work at a senior facility or work anywhere, you need to stay home. We're doing that through the Colorado National Guard, where we've tested over 1,000 people. We gave you the numbers of who was positive, who was negative, who was symptomatic, who was not. The other piece is the partnership with CSU to test 45,000. So both of those are happening during the month of May. We're testing Colorado National Guard, CSU, 45,000, May and June. We're continuing that work. We have the exact information that we gave you around the tests that the state did. We're going to work out exactly what gets reported from CSU. It may not be exactly the same as the state, but of course there's going to be a good level of transparency around that data so people have a sense of what's occurring. But just know how important making sure that those who are contagious without symptoms, getting them to not go in to work with our people in their 70s and 80s can save hundreds, if not thousands, of lives in our state. Because this virus is far more deadly for people in their 70s and 80s. From the room, we'll do 2 more. Yes?
A question from a colleague of mine, Governor. The oil and gas industry has taken a big hit during this COVID-19. Are you planning, or is the state planning on doing anything to help boost that industry and help it get back on its feet?
Colorado extended a number of tax deadlines. We extended the income tax deadline. We extended the sales tax deadline, working with counties, the property tax deadline. No penalties, no interest. People can file several months late. We also did that with severance tax with regards to extraction-related industries.
All of these county health departments that are going to be expected to carry out a lot of these testing sites are not necessarily equipped or have the funds to do so. More the manpower is the issue for them. How is the state going to be aiding them to actually carry out these tests when these are small departments that don't have a huge staff?
So yes, we are able to additionally augment that and support the counties. Many of them are very excited to get working. They were held back by supplies, which we're now giving them. So many of them are ready to go, especially in the larger counties. In some of the smaller counties, we can support that. We can move it in through our mobile facility. We can help forge partnerships with our local hospital to do it there. We want to make sure that we work with a wide diversity of public health authorities. For those that are taking the lead and are able to do it, we're a partner in working with them to have the supplies and logistical support they need. For those who need more support from the state, we're also happy to do that. That is all the time we have. I want to thank all of you for joining us. A lot of information about testing today. And we want to be smart and save lives. The better that we do as a state, the sooner that we'll have less interruptions to our economy, to our way of life, and we can save lives by acting smart, by staying home when you can, by being safer at home, and by wearing masks when you go out. Thank you.